to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famuyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks. What are the things that can affect fertility? So there are several factors that can affect fertility. I think one of the most significant ones, one is aging. As you get older, it gets harder for your eggs to be able to be fertilized. And lo and behold, we now know that age affects the sperm as well. Certain things in your lifestyle that you can do to help will be excessive alcohol use has been shown to affect fertility. So you certainly want to reduce that. Smoking is really not good for you because it does cause DNA damage and has been known to decrease fertility. And the little known one is medical marijuana. I guess, everybody's into it nowadays. Dispensaries are popping up all over the place. But do you know that marijuana is very detrimental to both your eggs and your sperm? So if you're trying to conceive and you're having difficulty and you're taking marijuana, you probably want to stop that. Another thing is your diet. The healthier you can get it to as close as a Mediterranean diet, like vegetables, nuts, fruits, certain fish, low mercury fish, will certainly start to get your body getting to prepare you for fertility. And if you have health challenges like polycystic ovary syndrome or high blood pressure, uncontrolled diabetes, you probably want to see your doctor and try to get those things treated and under control, because those can certainly pose a challenge. Other factors that can affect fertility will be your genetics. So you will find out more about this when you get a thorough workup when you first start seeking help. So let's talk about female fertility. What can affect female fertility? Well, common issues such as lifestyle, irregular menstrual cycles, for patients who have polycystic ovary syndrome or have endometriosis can affect their fertility. And also things like a blocked fallopian tube. One of the most common reasons people get a blocked tube may be an infection with chlamydia that was not treated before. Also, other inflammatory conditions such as endometriosis or patients who've had surgery before may have obstructed fallopian tubes. We've talked about it before. Your lifestyle is very, very critical. Diet that you follow, exercise, adequate sleep, just making sure you're well rested will be very helpful. So if you are trying to conceive, you can consider tracking your ovulation. I wrote a blog about this on medium.com on how to track your ovulation and other things such as your cervical mucus that you can look at. And try to have a healthy lifestyle. Try to avoid smoking. Most certainly try to avoid marijuana. It's not good for you. There's nothing medical about marijuana when it comes to your fertility. All those things can make a big difference. So if you're having problems conceiving, please do not hesitate to get help early on in the process. So the fact is that just as female fertility issues are important, common issues also affect the male side. For instance, you could have a low sperm count or no sperm count. Low motility, the sperm can't really swim. That can impact its ability to fertilize an egg. The shape of the sperm, a wrong shape, and it simply cannot penetrate the egg, or not enough volume. Now, other things that can affect that is your lifestyle. So if you have excessive alcohol consumption, smoking, um, and an unhealthy diet, those can impact your testes, your sperm. In fact, the sperm has been called the semen analysis of your sperm has actually been termed a vital sign. So if the semen analysis is off, there may be other health issues going on that might be causing that. So, an abnormal semen analysis is an occasion to explore and really thoroughly investigate the male side to make sure that nothing else is going on. One of the things I diagnosed a while back was a patient who actually had testicular cancer, and it was first picked up when his semen analysis was abnormal. And on further troubleshooting it turned out he had a very small tumor that would have been missed if we hadn't been looking at the sperm. We also know that things like excessive heat exposure can affect the sperm. If you think about it, the testicle has evolved to be outside the main body mass, so it's a cooler temperature, and so excessive heat to the testicles, if you're in the sauna, in and out a lot, hot tubs, jacuzzis, whatnot, if you already have a bad semen analysis, that's not helping. There was actually a study where they actually had some men apply cooling packs to their testicles, and some of these men were able to improve their semen parameters. Of course, it's uncomfortable to do that for a long time, but certainly heat is a very big factor. So, if you're having challenges with conceiving, please seek your physician out and get a complete workup. Your semen analysis may be the first clue that something is going on. Have it figured out. Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famiyiwa.